Hello, Dr. Hall here, recording some comments on alterations in immune function from Chapter 31 of Tager and Knapp's 2024 textbook, Chapter 31. So there are certain immune system components and principles that are important to underpin our discussion here. What we're trying to do with our immune system is defend against infection and maintain equilibrium in the body. If we can't do that, we have underfunctioning, which is immunodeficiency, and if we have overfunctioning, autoimmune disorder or hypersensitivity reactions can occur. Immune functions can be nonspecific or specific. Humoral immunity involves B cells, which recognize specific antigens and secrete antibodies. Cellular immunity involves T cells, which we're familiar with, and lymphoid organs can be primary or secondary in the immune system. How are we different in pediatrics than adult immune system? Well, infants' organs are large at birth in proportion to the rest of the body. The thymus shrinks in size at puberty. Peyer's patches increase in number until they peak during adolescence. The spleen is smaller at birth and does not reach full size until adulthood. Children's abdomens have less fat to protect immune organs. They are at higher risk for splenic rupture. Therefore, when we're doing health assessment, we don't palpate the infant's belly. Children have decreased amounts of immunoglobulins, so their immune system is much less effective. So what responses do children have? They have a higher risk of developing infections because the immune system is immature. Signs and symptoms of infection are less prominent in children, so harder to pick up an infection. Children have a higher risk for sepsis developing, and environments where children are in close contact with another child make it easier for infectious agents to travel. Daycare, going to school. Poor hygiene behaviors can increase spread of infection. Majority of the immunizations are given during childhood, so if there's parental decision not to immunize, children are more at risk of contracting any kind of viral infection. Active immunity includes humoral and cell-mediated, and passive immunity is immediate but lived. This is a slide that gives you the immunoglobulins. I suggest that you just take a minute or two and look at this to tell the difference between IgA, D, E, G, and M, and what do they do. Which of the following immunoglobulins provide primary protection against bacteria, viruses, and fungi? Is IgG. It provides protection against bacteria, fungi, and viruses. It's the only immunoglobulin that crosses the placenta. This immunoglobulin is also responsible for Rh factors and activatase. So what do we do for immune disorders? Prevent and manage allergic responses, promote skin integrity, and promote comfort and relief. Also, paying attention to growth and development, what treatments are appropriate for whatever level of growth and development we have or immune response, and provide psychosocial support to the family, including the patient or the infant or child. So what are our primary immunodeficiency disorders? Over 300 chronic inherited immune disorders classified here. We're not going over 300 immune disorders. There are just a few in this presentation. What is our concern? Risk for developmental delay, the manifestation itself. If there's something very severe, we can do stem cell transplantation or giving IVIG. One of these syndromes is called the Wiskott-Aldrich syndrome. It's an X-linked recessive disorder and a form of congenital thrombocytopenia. Disease characteristics include thrombocytopenia, small platelets, eczema, immunodeficiency. What do we do? All we can do: stem cell transplantation, IV immunoglobulin, maybe splenectomy, and prevent secondary infection. Which of the following is not a manifestation of Wiskott-Aldrich syndrome? Jaundice. The liver is unaffected by this condition, so jaundice is not a sign or symptom. So there's a disorder for children called SCID, severe combined immune deficiency. We have absent T cell and B cell function, presents within the first 6 months of life, 5 different types of this, potentially fatal, requires emergency treatment with stem cell transplantation. So it means that a little human is born with no ability to fight off infection. Manifestations, serious bacterial, viral, and fungal infection, long-term antibiotic therapy or IVIG. We manage it with positive pressure isolation in the room, which, you can't stay in that kind of an environment. We don't really have people living in bubbles. Only use irradiated cytomegalovirus, negative blood, and transfusions. So very severe. Hypogammaglobulinemia. It's a group of B cell disorders in which immunoglobulins are inadequate or absent. There are several different types of that. Symptoms begin around 3 months. You can have secondary immunodeficiency occur with human immunodeficiency virus. HIV-1 is present worldwide. HIV-2, primarily West Africa only. It's an acquired vertically transmitted or horizontally transmitted from unprotected sex and non-sterile needles. So, more of an adult concern there, but remember, in childhood, and we are studying that age of adolescence. What happens? Chronic diarrhea, failure to thrive, delayed development, and frequent infections. And there's a shorter latency period to acquired immune deficiency syndrome than in adults, so you see the symptoms quick. What do we do to treat? We prevent encephalopathy from AIDS. We prevent prenatal transmission from HIV-positive mothers by avoiding breastfeeding, preventing contact with maternal fluids, except delivery. Got to take that chance. And maybe have C-section scheduled. Also bathing and cleaning mucous membranes soon after delivery. They get what we call a medication cocktail, a HAART, H-A-A-R-T. You see that talked about here. Also systemic lupus erythematosus, and this is that chronic and very obvious butterfly red rash on the face. Juvenile idiopathic arthritis is also considered an immune disorder. It's an autoimmune disorder, and there are 3 different types of it. Can present with joint symptoms of redness, pain, warmth, swelling, and stiffness that are increased by inactivity and system manifestations. What do? We promote normal lifestyle by managing inflammation and pain, treat with non-steroidal anti-inflammatory drugs, and encourage activities like swimming to promote joint mobility. Allergies in infants and children, so we're talking about hay fever and just, allergies to pet dander and so forth. Common allergens here for children and infants: cow's milk, eggs, wheat, chocolate, citrus fruits, mold, pollen, house dust, pet dander, and there are medications available just like there are for adults. Food and latex allergies can also. Is the following statement true or false? Food allergies can be diagnosed only by challenge. There are multiple diagnostic tests that can be used to diagnose food allergies. We have prick tests, allergo absorbent tests, blood tests, IgE tests, challenge tests, so anaphylaxis, let's mention this, goes with the immune system discussion. So children and infants can reach anaphylaxis a lot quicker than an adult. It's an acute, immediate, and severe IgE-mediated response to an allergen. Most common triggers here, I have a niece that's allergic to strawberries, and nuts, shellfish, eggs, all included. Usually occurs within 5 to 10 minutes of contact. Tissue edema leads to vasodilation and circulatory collapse, and they get a rash, coughing, lip and tongue swelling, maybe loss of consciousness. And then we treat with IV epinephrine, corticosteroids, and antihistamines. When an infant or child, an adult for that matter, is exposed to something that they're allergic to, and then they have a mild reaction, we call that an anaphylactoid, TOID, reaction, meaning that perhaps you could have 1 or 2 anaphylactoid reactions that need to be treated, but once your body is sensitized to that allergen, then it will progress to anaphylaxis. So if you have prodromal reactions, they have to be taken. Support the airway, intubate, assess circulation, administer IV fluids. This is not something simple, and usually hospitalization or ER visit included. So when we know that we have some allergens, so for example, bee sting, and we have an anaphylactoid reaction to a bee sting, and we know it's going to progress and be worse, and I could die from it, usually there's an epinephrine auto-injector ordered, and you see a picture of that.